All right, everyone can hear me. Usually people don't have a problem hearing me, but having this microphone has been nice. I'm Dave Scott. It's kind of cold in here. I'm from Denver, Colorado, and yesterday I was telling some people I was shoveling snow before I left to the plane to come here, put my shorts on when I got here. It's kind of an interesting day. Go Broncos. I didn't get to watch any games the other day, but I saw that the Broncos won against the Chiefs, which is, I think they lost 16, 17 in a row, the Chiefs, so it's kind of cool to see that. We're going to be talking about wearable medical technology. And what is wearable medical technology? Well, it started out as fitness devices, technology that can be worn such as smartwatches, smart glasses, smart rings, clothing, attachable or implantable devices. So my watch, it's also a wearable medical device, even though it's not classified by the FDA as a medical device, which we'll talk about in just a minute. Wearable electronic devices connected to the wearer can detect, analyze, and transmit information such as vital signs, mostly right now to your phone, but we'll see maybe in the future we'll be able to do a little more. In some cases, immediate biofeedback to the wearer, which we'll talk about. I actually started studying this wearable technology because of a health event that happened to me, which we'll talk about kind of towards the end of the presentation, what happened to me and how I figured it out and how the wearable technology really helped me a lot. Kind of some cool info. What is wearable technology? It's type 1, so there's different types of medical equipment. Type 1 is non-FDA approved. Wearable technology and smart devices kind of fit under that type 1. Type 2 is FDA approved. And then when you have FDA approved, you have different classes, class 1, class 2, and class 3 of FDA approved. So class 1 is low risk equipment, like a stethoscope. Class 2 is if it's used incorrectly, it can pose a risk to the operator or patient. I gave an example of an ECG. It could be wrongly diagnosed, I guess. And then class 3 equipment can harm patients and the users if used improperly, like a defib, electrosurgical unit, something like that. So what we're going to be talking about is all this type 1 that's non-FDA approved. At least at this point, most of it is non-FDA approved. There are a few devices that are FDA approved. And I think this slideshow, and I'm being recorded, so you'll be able to see all this on MD Expo website. So some wearable devices such as Holter monitors, insulin pump are actually prescribed and FDA approved. So the history of wearable devices, some of these devices you don't think of maybe as like a wearable medical device, but eyeglasses, hearing aids, wearable wristwatch, being able to tell time. We'll talk, obviously the wristwatch has evolved way more since the 1900s. Pacemakers in the 1930s, Holter monitors, or they call it radio telemetry back then. 1970s temperature detection on watches and calculator watches. I look around the room and I see some people that are probably my age or maybe a little older. You remember the calculator watch? Yeah, I mean, like when I was in, I think it was high school, if you had one of those, you're like one of the coolest people there was. History of wearable devices. So in the 2000s is when we started seeing like more of a progression in technology. And I always tell people like the technology curve is kind of like, it kind of goes up like this. Like the more stuff you invent, the more stuff you can invent. So it starts getting steeper and steeper and like more and more inventions with other technology being invented. So wearable cameras on watches, Bluetooth, which was a key development, which we'll talk about a little bit later. Then 2010 was the Fitbit, so really not that long ago, only like 13 years ago, 12, 13 years ago. 2013, the near field communication ring, NFC ring. Does anyone know what near field communication is? Does anyone stay here at the hotel? Did you run your key over the door and open the door lock? That's near field. Or you use your credit card to pay, you don't have to stick it in or anything. Like You just kind of swipe it over, that's near field communication. Smart ring, and pretty much everything that says smart in the word is smart, whatever technology is all where it has some kind of wearable component to it. Samsung Galaxy, and then after Samsung Galaxy was the Apple Watch, which is what I have, Apple. These are just the different, this is the Oura Ring. And then this is the calculator watch I was talking about for those of you that are younger that have probably never seen this. That's what if you had that, you were like super cool back in my day. Hearing aids, Apple Watch. These are Apple Watch's different versions. So you see like, there's 4 sensors, there's a few more, then a few more. All these are like lasers on the back here. Oh, looks like my lights are gonna go back up. Can you guys still see that? Yeah. I know there's a way to turn it down if someone could try to do that, but that's different technology of different stuff that I've talked about. So insulin, I chose insulin pumps as a history just because I thought it was really interesting, like for kind of like where they came from to where they are now. And this is an insulin pump, this big piece here from the 1970s. It actually, from 1974, it had closed loop insulin delivery system. And you see this patient sitting, laying here, they used it mostly for patients recovering from surgery that had diabetes. And they needed to regulate their blood sugar levels when they're recovering from surgery. So this was the first FDA approved insulin pump, we'll call it. It was 60 kilograms. What is 60 times 2.2?
The answer is 120.
120. Did you hear that? The answer is 120. There's my calculator watch. Like the old calculators. So 60 kg. That seems like a little low for. Maybe I didn't hear me right. 60 times 2.2 is like 132 pounds, I think, somewhere in there. But this thing was super expensive. $50,000 a month to rent for the hospital to have someone on this. And it's used for diabetics with type 1 diabetes. So type 1 is insulin dependent. Fast forward, 2023. 2000's wearable glucometer, wearable insulin pump, app for pump and for glucometer, closed loop operation, same as that other old one. Bluetooth technology, so the sensors all read by Bluetooth to the phone. And the phone kind of acts like as a home base for everything. Better A1C. Does anyone know what A1C is? A1C? Any lab people in here? A1C?
3-month average.
Average hemoglobin level, your average blood glucose. Yeah, so the better, whenever you have diabetes, one of the numbers they always look at with diabetics is A1C. And the lower the number is, the better it is for like long-term and organ failure and that kind of thing. So they want to, most diabetics on these pumps, they can lower their A1C by 1 point. So if they're around 7, 8, they can lower down to 6, which is really good. Anything in the 6s. So it usually makes a huge difference for people with diabetes. It can do reports, alerts, so it can alert high blood sugars, low blood sugars, real time, kind of based on the feedback from this glucometer. Remember that? Does anyone remember the old glucometers where they stick their finger and you read into the? Those are still around, and actually you can use them to calibrate these. So this Dexcom is like one of the newest glucometer. It's a blood glucose meter. The glucometer reads to the phone. And then if you look on here, this is Medtronic. This one is called Omnipod. Omnipod's like the newest version, and it actually uses smart technology to kind of predict the wearer's blood sugars based on history, and it can actually adjust kind of more real time using that smart technology. But this one's Medtronic, and this is actually the pump, and the insulin kind of goes in this little vial right here. Then it's directly injected into the patient through this little patch here. And then this is the glucometer. This glucometer here reads to a phone. Off of that, you can get all these reports. And the doctor can actually download all these reports, and the patient can look at like this is time going along here, and then this is what sugar level one, it's hovering right around 100, you know, see it going up and down, and then the high and low limits here on that, like the borders on that. So there's a lot of reports that can be loaded off. This is actually data from my wife's pump. My wife has an insulin pump, and she was telling me the first time she went to the doctor with the new pump, they downloaded all my stuff, you know, and got all my info, and they were able to predict my A1C and tell me, and then they ran the A1C and checked it against the, you know, the blood draw, and it was almost the same, and she was pretty excited. But this Dexcom, that's the blood glucometer, all this info here, and you can see different alarms and alerts and so on and so forth on there. So what are our normal vital signs that we monitor in the hospital on patients? We have 5 vital signs that are the big ones, I guess. Core temperature, heart rate, respiratory rate, blood oxygen or pulse oximetry, and blood pressure. So what can we monitor with these wearable technologies? Heart rate, SpO2 or blood oxygen, respiration, blood pressure, body temperature, and it started out as fitness devices, I said, so it tracks steps, like everybody's probably counting their steps, how many steps you're getting in, because you're sitting in class a lot here, maybe not walking around as much as you do normally at work. And it can track sleep and heart rate variability. Does anybody know what heart rate variability is? No? We'll find out. You'll know the answer before you leave here today, what heart rate variability is. And it's one of the key things that can track, detect what's going on with your heart. So the smartwatch, this was all the NFC rings, near field communication rings. And these are all sensors around the bottom here. You know, you see these pieces, and that's kind of the same as the watch. This one's called an Aura ring, spelled O-U-R-A, Aura. And it also reads like near field communication to your phone, is where that info goes to. So the smartwatch, and there's many different kinds, not just the Apple Watch. I have the Apple Watch, so that's the one I know the most about. There's many different kinds that can do quite a bit of different stuff now. They even have a watch that does blood glucose levels. Pretty much anything that you that your body puts out can be analyzed, and some kind of stat made from it. Were any of you in the class in here before you were in here? Dr. Larry was talking, and he said they wanted to do a home health technology on a toilet seat that picked up ECG. And he actually had the ECG trace, like the toilet seat, because it was used for elderly people. They didn't want to hook patches to them, so they could pick up an ECG off a toilet seat. And I thought that was pretty cool, but that's kind of what like the smart technology does too, all this stuff on watches and rings and so on. So step counter, respiratory rate, blood pressure, calorie counter, which is kind of the fitness part app, pulse ox or blood oxygen. For whatever reason, they call it blood oxygen on the monitors, on the watches. Temperature, ECG, electrocardiograph, fall detection, so I can tell if someone's fallen, like on your phone, and then connectivity with your phone or your home base. That, like older technology had the hardest part about wearable technology was where do you transmit it to? Like back in the 70s or whatever, like 60s, even in the 80s, 90s. Then when we got the phone, it almost acts like as a computer. The first wearable technology, they actually had like a backpack that had a big computer in the backpack that read to the computer in the backpack. Now we have a phone that has better computing power than what a lot of the old computers had. So all those vital signs, you saw that the watches and the rings can all do pretty much all the vital signs that we look at in the hospital. So it's pretty much anything can be determined from these wearable technologies. So is it comparable to hospital equipment? What do you guys think? How close is it comparable? ECG, pulse ox. Have any of you done any comparisons? You have, Myra? What did you find?
Yes.
It's pretty accurate.
Like, I have
Yeah.
the Apple Watch, which is my heart rate. And
Yeah. My heart, I checked my heart rate with like a pulse oximeter. And my Apple Watch actually adjusted faster than the pulse oximeter that I was reading. I'm still trying to figure out how to put electrodes on my watch and use it like a patient sim. I haven't quite figured that part out yet, because whenever you take your watch off, you have to, like, when you put it back on, you have to punch in a code, and it senses that you're wearing it. I haven't quite figured out how to do that with electrodes yet. I'm still messing with it a little bit at my desk every now and then at work. So, like this is my arm right here. This is the Philips patient monitor, and I did my pulse ox 96%. This says blood oxygen 97%. It said measurement taken in high elevation environment. I live in Denver, like I said, so it's a mile high, 5,280 feet there. So I actually noticed like where it was taking the reading at too. So pretty close. And looks like my heart rate here was 69. I didn't report my heart rate on there, but I've done other comparisons as me as the, like, I guess as the patient sim myself. And I found, like Myra said, it's pretty close to what the actual model is. So even though it's not an FDA certified device, it's pretty close to what we have, like FDA certified devices. So this wearable technology, it can create a healthier patient population. So patients with chronic diseases can have wearable devices to reduce the number of hospitalizations. Patients can adjust routines according to diets, according to data displayed on their device, like that. I was talking about the blood glucometer on the watch. There's people that monitor their blood glucose, like everything they eat, they kind of watch how it changes their blood sugar, and they change their diet. It's called biohacking, and they kind of change their diet based on how high, because different people react differently to different foods. So if you have a food that spikes your blood sugar, maybe they don't want it spiking, as much. So they eat kind of different foods and change their diet, change the way they do things, and also tracking, of course, exercise. This can save expensive treatments and cost of hospitalization. Like when I get to my study, I will show you like kind of what happened with me, and you'll see kind of how this works too. Monitoring sleep. One thing I found having some health problems that I've had, and since I've been tracking I track my heart rate variability, which I'll talk about a little bit later, but I track that on my watch, and I found that like a lot of crazy stuff happens when you're sleeping. Has anybody ever, like, if you don't wear like a BiPAP or CPAP and you're maybe overweight like me, maybe have other health issues, when you're sleeping, there's crazy stuff that goes on. When I had to wear a Holter monitor for a little while, and I got a call from the doctor's office, and they said, "What were you doing at 1:30 a.m. last night?" I was sleeping. Why? Well, and whenever you wear a Holter monitor, I'll tell you, anybody that has one, if you ever have to wear one, it's like a guessing game back and forth, kind of like that Who's on First routine that you heard of Abbott Costello. They don't tell you what's going on, but they ask you questions because they want to know if you notice that you're in an arrhythmia. So that if it's uncomfortable for you or whatever it is, if you don't notice it, then they don't do anything. They just say, "Oh, well, he's dealing with it fine and everything's good." But if you notice, "Oh, I felt this way or that way, I felt really uncomfortable or whatever," oh, then we need to look into it further and do something, maybe an ablation procedure or something like that. But if you don't notice anything, they just say, "All right, keep on going, take these pills, you're good." So heart rate variability. Heart rate variability is the spacing between the R waves. Why is this important? So normally your heart is in automaticity. It automatically goes and it's in a regular rhythm. If you're exercising or moving or doing something, it goes up in rate. But usually the time in between the R waves is consistent. And you'll see when we'll look at some ECG traces where they're not consistent in a couple minutes. But that's how it can determine AFib, is by the heart rate, the spacing heart rate variability. And when your heart rate variability My watch actually tracks every Monday, I think it's this morning when I was sitting in class, I got a report. It tracks my heart rate variability over a whole week. It tells me, usually it tells me I'm less than 2% heart rate variability. My heart rate variability is less than 2%. I've had, kind of let the cat out of the bag about my study later. I have AFib, intermittent AFib. I've had when I'm in an AFib, when my heart rate variability went above that 2% per week. It went to 3%. I had a day that I was in AFib. My heart was going crazy, which I'll show you what that looks like on the watch in a couple minutes. So blood oxygen can tell if the wearer stops breathing or his O2 is lowered. And that's especially important during sleeping because people with sleep apnea, they stop breathing and their O2 level goes lower. And the watch actually tracks that. And even when you're sleeping at night, it can detect your motion while sleeping, so to tell if you have good or bad sleep, you know, how deep of sleep you had. Can detect early sleep apnea. Sleep apnea can lead to other problems if untreated, like those heart arrhythmias I was talking about. Wearable sensors and clothing. Now there's even clothing that you can wear that has wearable sensors. I have a picture of some. There's a brand called Exoskin. It does a 3D ECG. So if I do my watch, does anybody, have you ever done your, I know you probably have, but ECG on your watch, you put your finger on your little piece there. I'll just flip to it real quick. I don't think you guys will be able to see the screen from back there, but it's just called ECG. And I can put my finger on there and I can start taking an ECG reading. And it takes it for 30 seconds. And then it reads to my phone. And I can look at the report on my phone, which we'll look at in just a minute how that works. So this wearable sensors, when I'm doing so if I'm doing the ECG on my watch, I'm going from right arm, putting it on here to my left arm. So I'm reading lead one across right arm to left arm. So I'm only able to read one lead on my watch. But it's enough to determine for sure AFib. So these wearable sensors, the clothing, it has metal woven into the fabric. And it can detect respiration, pulse ox. This is where a lot of really high-end athletes wear these things. You'll see in just a minute. Skin temperature, 3-axis accelerometer. Has anyone ever done anything with accelerometers? It's not really a biomed thing as much. Accelerometer, like that fall detection I was talking about earlier, that's what it uses, an accelerometer. So it can detect like gravity. Like if I know Kelly, I think it's from Indianapolis. Whenever they're racing there on the racetrack and the car goes into the wall and they're able to tell like how many G-forces the car hit the wall with, they do that with accelerometers. That's an accelerometer. So this uses a 3-axis accelerometer, so 3 different directions, X, Y, and Z direction. Non-invasive, the stuff is not, the whole thing is non-invasive. Machine washable, and one good thing with like the wearable stuff is this clothing is you can get a bigger battery in this clothing than you can like my watch, so up to 36 hours. And it, of course, reads Bluetooth to phones, clinically validated by research labs. This is what it looks like. There's even a headband, and then these sensors are part of the fabric. It's all woven into the fabric. So blood level, oxygen levels, 3D ECG, breathing rate and volume, skin temperature, activity level, that's the accelerometer, and then blood pressure, all off of this wearable suit that people, and like I said, a lot of high-end athletes wear these in training. With the miniaturization of electronics and things getting smaller and smaller, I remember when I was in school, the biomed school, like 1989 is when I went to biomed school, not the age. People can tell I'm old by looking at me, I guess. But I remember our teacher, he said, if we had a 1 farad capacitor, it would be the size of this entire room. And I'm like, wow, 1 farad, that's crazy. We measure like capacitors in microfarads and even smaller picofarads, nanofarads, really small amounts. If we had 1 farad capacitor, it'd be like no one has ever seen anything like that. Fast forward to this year, 2023, there's megacapacitors. They're measured in kilofarads and megafarads, and they use them to replace like battery technology. It's kind of one of the new things like evolving for battery technology is megacapacitors. So in that amount of time, 50 years, well, not even 50 years, 35 years, 34 years, it's gone from like super big to super, super small, now to like just membranes like this that you can have electronics on. And this could actually be worn as a patch, like on someone's arm, like as a tattoo almost, and put on people. So this is organic CMOS logic circuit. And its thickness is 3 micrometers, so really, really small. So, and then you can see this is just kind of more of the same stuff. Heart rate variability, I've got a definition for heart rate variability. Heart rate variability stands for heart rate, HRV, it's called it sometimes, it stands for heart rate variability. It's the measure between the interval, measure of how the interval of time between heartbeats changes. You don't notice these tiny variances, but devices like Apple Watch capture HRV, which is measured in milliseconds. Heart rate variability. So you get a report like this on your phone. If you look at your heart rate variability, it measures, this was from just earlier this month. And you see the scale here, and then this is time across here. And I said like crazy things happen when you're sleeping. It seems like every night when I'm sleeping around this time, my heart rate variability goes higher than it does like other times. And it tracks pretty, I mean, that's pretty close. And usually they say like below 100 is pretty good. I have some heart rate variability and have issues with that, so mine's probably a little bit higher. Apple Watch looks at big changes. So you see the scale, if I go back a slide, this scale only goes to, there's 150 there, goes to 50. If I go to this next slide, all the way up to 400 milliseconds, heart rate variability. I was in AFib at this point on this heart rate variability, and you can see it goes back to normal for a while, then it goes crazy, then it goes back to normal. 500 milliseconds, well, that's half a second, right? So there's like almost a half second variability between R waves. So this one, it said my average was 166. This one average was 32. So this is normal, like normal condition, but easily able to detect heart rate variability in this with this Apple Watch when it's looking at this. So easy way to detect. And it's funny when I scroll back on my scale, that kind of this part of the scale that goes off the screen, and then it readjusts the scale whenever I do that. But this is so beat to beat measurement, heart rate variability. And if you look at these, they're all pretty much the same time. 12:17, 12:17, 12:17, and then milliseconds, I guess here, and then I don't know if that's microseconds, I don't know. But it's all 12:17. But in that 12:17 from 25 to 32, this is how much my heart rate's changing. My variability from 106 all the way to 54 back to 100, and then like one time later 53. So it's varying a lot. It should be almost more flat like that graph, the first graph that we looked at. So that's how these watches and rings and so on, they can detect AFib, because when you look at AFib, you have a lot of heart rate variability. So this is actually a recording that I took off of my Apple Watch. This is lead one recording. And when you do a recording, it just tells you like if you're in normal sinus or if you're in AFib. And then it asks you, there's a part on there where you can export the report. And this is the part that I exported. And it looks just like ECG you would run like on the graph paper. You should even has the calibration square wave here at the beginning to know that that's 1 millivolt and that's 1 second or half second, and or 0.5 seconds, I mean. So if you look across here, you see how there's a big space here, and then there's like a whole bunch of heart rates together, and then there's kind of some spaces in between, like here and down here. That's AFib. It's not consistent, the heart rate. And if you look down here, it says all that different all the different ECG like parameters, 25 millimeters per second, so on, all the stuff that we would see on regular graph paper, just like in the hospital. So what do we do with this? It says here, if this is an unexpected result or heart rate stays high, you should talk to your doctor soon. So with me, originally I had atrial flutter, and I just kind of got diagnosed by accident. I was at just a regular doctor's visit, and they said, your heart rate's really high. And I said, well, how high is my heart rate? It's 140 beats per minute. I'm like, oh, wow, that's pretty high. And I just walked in from the parking garage, but probably still too high for that. We're gonna send you to your primary care doctor. Okay, so I go, it was just across the street, go to primary care doctor. They hooked me up to EKG, run EKG of the cart, run EKG on me. Okay, wait a second here, and we'll be back and talk to you in just a minute. Okay, I'm thinking something's going on here, like, why aren't they telling me anything? The doctor comes in and has a stack of papers. We're going to send you across the street to the cardiologist's office. They're expecting you. Just tell them when you get there. Great, like, what's going on? Like, I don't know, I have no idea. I just know my heart rate's really high. Well, it ended up I was in atrial flutter, which is the atria are going like a lot faster. The atria are the top part of the heart, the filling part, the filling chambers, and the ventricles are the pumping chambers. So my atria were going crazy. And then I finally got to talk to the cardiologist. He came in there. He said, you're in atrial flutter. Your ventricular rate is 140. Your atrial rate is 300. So it's 300 beats per minute. And I didn't even know. I was just like hanging out in the waiting room, like, okay, I'm here for my appointment. Like I'm good to go. Like nothing. So about a week later, I had an ablation procedure, and that went really well. If you've ever had any CAT procedure, they go through the femoral vein, which is kind of, if you bend your leg right here, it's right where your leg bends, which kind of sucks when you like after this procedure. But they go up and into the heart through the descending inferior vena cava, so up through the vein that comes up back into the heart, and then they're able to ablate in the heart. And atrial flutter is all on the right-hand side of the heart. AFib is more on the left-hand side of the heart. So to go from left to right or right to left, you have to go through the septum, so through the wall that's in between. So it's more invasive, obviously, than just going to the right side of the heart. So AFib is a lot bigger procedure, usually stay overnight, so on. But this can all be managed through medication. I take some medication that like lowers my heart rate. My resting heart rate, I look like I'm a super athlete, like it's like in the 40s. But I'm not, looking at me, you can tell I'm not a super athlete. But this EKG ended up resulting in this. I went through my health app that I have at work. I said, I'm trying to see if this works. I talked to you earlier today. Is this photo of the readout good enough for diagnosing? Thanks, David Scott. And you can see I have an attachment right there. That attachment is this ECG. And then this is from, it's a PA that I see that the cardiologist. Hi, David, it works. We're able to see the rhythm strip you attached clearly. It was nice speaking to you earlier today. I placed the stress test orders in. Let us know if you do not hear from someone regarding scheduling by next week. Thanks, Celine. Celine Fan is my PA that I see there. So with this wearable technology, I work in the hospital, but I never stepped foot in their office. I never was in the doctor's office at all for any of this. The way that this resulted was I had gone like several times because I felt funny, I don't know what's going on. And the last time I was in the urgent care, I called into work, went to urgent care, got checked out on EKG. Oh, everything's fine. My wife, it's always the voice of reason, right? Your wife says, we need to stop at the mall on the way home and you need to get an Apple Watch and start recording. So that's when I got the Apple Watch and I started recording my EKG. And that's when I figured out that I had this. And that's how I was able to send this report many times. I don't even know how many times I went to the urgent care and the doctor's office and so on. And they never caught it because it was so intermittent that by the time I went in, everything was fine. So with this, I was able to schedule a stress test, and the stress test is, the one I did was 2 days, it's a nuclear stress test. So one day is just relaxed, and then the second day is exercising or walking on the treadmill. I did it during COVID and had to wear a mask the entire time I was on the treadmill, which really wasn't a lot of fun. But can you see where this wearable technology, where in the future, we're able to do more diagnostic at home or on patient from home, and if someone's actually analyzing and looking at like my heart rate variability, probably a long time ago, I would have known that instead of like having to go through all this, that I was having these problems. So in the future, biosensors can measure skin conductance, so not only like temperature, but conductance, heart rate, body temperature, as well as detect changes in pH, glucose, salt in the human body, also through sweat and tears. The tears can be analyzed for blood sugar levels too. They actually have some technology now that does that. Tattoo-based epidermal biomedical sensors, like those thin, that real thin film, like electronics that I was looking at, that I showed you, that organic, real small electronics that look like paper almost. So tattoo-based. Clothing, like we looked at with the metal woven fabric. Sweat glucose monitoring can combine pH, humidity, and temperature sensors to have improvements in therapeutic application of diabetic care. So that, I think a lot of the like medical technology, the wearable stuff and advances started with diabetes. So like this diabetes, saw that, that's why I picked that old school insulin pump compared to today's insulin pump. And also in the future, battery power, yeah.
I just discovered on my Apple Watch that I just recently got, we were over at Epcot listening to live entertainment.
Oh yeah, they told you it was too loud.
90 dB, and I needed to get to 30 or whatever it is. It actually told me that.
Yeah, I think I've been driving in the traffic and I had my window open and it told me, you're in a noisy environment or something like that. Yeah, so it looks out for your hearing protection also. And I know someone else that told me that they got contacted when they fell. They were, I think the lady said she was skiing. Have you had that before, Myra?
She fell home at the emergency.
Oh my gosh. So she fell and it called some emergency contact. Yeah.
Yeah, once the night before too, where it told me, I hit my hand or something on something, and it tells you, did you fall?
Oh, yeah.
I call my mom.
Yeah.
I had to say, no, I didn't.
Wow. So the fall thing is really like a big thing now. Like, I know previous to any like smart anything, my grandma had like a fall alert thing, and she had to like hit the button every so often to reset it, and she would forget and they would just show up at her house, but it had a fall detection thing on it. Same thing, but now it's all on your watch. Yeah.
My fiance got into a car accident and I got notification.
Oh wow.
They detected that.
So you knew about his car accident before he told you?
Yeah, before he told me, I found out and I freaked
What are
out.
you doing?
And I called and he wasn't picking up, so yeah, but
Oh no.
yeah, and then
So it was able to all detect, notify you, so you can send it who it notifies.
Oh, and also he received a call from the police right there and there.
Oh, wow.
Without calling 911, the police was already called.
Oh wow, they already called it with the fall detection part. So yeah, like future, you can see how the future is bright with this stuff. Battery power, if you remember, like just a few years ago, like how big batteries were compared to how small they are now and how much they can do. And I think that they're working on solid cell technology now, because like lithium ion is liquid based, and solid cell, they say that it'll be either half as big as what the current battery is, or twice as much power with the same size battery, so double what we have now. And there's actually a company in Colorado called, I think it's called Solid Technologies, that they're working on solid. They work with a lot of automakers. So a lot of these automakers are driving like the battery technology for electric cars. But that trickles down to like wearable medical devices or even some devices we have in the hospital. So, and then some of the wearable devices like that clothing can have solar on them too to power things. more sensors in development. So cancer detection and wearable technology. I have a picture in just a second. It's a bra that can detect breast cancer. So the wearer it moves like different positions on the thing, and it transmits, of course, by ultrasound. It's an ultrasound detector. I have a picture of it just for interest. And I have some links too in my links. More sensors in development, cancer, talked about that. More sensors could lead to more and different technologies in hospitals. So this is like wearable technology. I don't know if any of you are going to be here tomorrow, but I'm doing a little commercial for my presentation tomorrow afternoon. It's on medical device. It's like future technology. And part of it is this wearable technology, but part of it is also hospitals in the future will be more just for like higher acuity patients, and more stuff will be done at home than it's done in the hospital at this point. You look at like all the big players that are in all the home health stuff, like Best Buy, Apple. I even saw Costco the other day. Do any of you go to the HIMSS conference? Healthcare information. Yeah. Was that really big at the HIMSS conference? Home health. Yeah. There's a lot of big displays that are home health companies, right? Like Best Buy, it's a big one. I know. I'm trying to think. I think Berkshire Hathaway does something with it, that company of it. But I think in the future, hospitals will be more for really people that are really sick that need to be there, not as much. And we see already with COVID, we see like how many virtual appointments you can have. And like whenever I had a virtual appointment, I always felt like, okay, how are you feeling, Dave? Okay, I'm doing great. Okay, good, thanks. Send me the bill. Here you go. They don't really look at anything. I'm like, man, I don't even get like the blood pressure cuff. I don't get the pulse ox. I don't think at my doctor's office, they just ask me how I'm feeling and that's it. And during COVID, does anybody have Scotty killers at work? Scotty killers like a little sticker remover thing. And the ones we have are metal. They're really sharp, I found out. I cut my finger and I had to get stitches. And I went to the emergency room at work and got like 3 stitches right where my finger bent. So they're like, we can probably glue it, but probably just gonna come apart, so we'll put these stitches. Well, I ended up getting an infection. And it was during COVID, so I had all these virtual appointments. So I'm trying to hold my phone up to my finger to show the doctor, like, this is ridiculous. We should have something better than this. And okay, we're just gonna send you, here's some antibiotics, we're good. Like, that's always the answer, is to send me some pills. But I thought, how good would virtual visits be if the doctor could download your information, like that information that I was showing you from my wife's glucometer? How good would I have a virtual appointment be so much better if I could actually have the doctor having some vital signs and maybe have some, like, look at reports, and on those reports, you have like some kind of AI that's analyzing those reports, and it pulls out the highlights or the lowlights, and it sends them to the doctor's attention. These are the things we need that the AI thinks are important, instead of looking through page after page. Because you can imagine how much data like each one of us would create if we're monitoring ourselves 24 hours a day. It's overwhelming, but with AI, it can filter through all of that. So more data, better connectivity. There's actually, Amy has a committee working on like wearable technology, like mostly for insulin pumps is where a lot of it starts, because that's an FDA device, but secure communications for this. Because right now, if I goes into the cloud and who can hack into it, who has my information, I have no idea. Whether or not that matters or not. More miniaturization, I think, in the future. AI smart, even making it even smarter, that interpretation. This is a picture of that bra that can detect cancer. So there's a sensor, you can see that wire, there's a sensor up here and it moves, it actually moves, you can see that there's like a trap on here and it moves around. I think normally this is like a sports bra, this would be actually the bra the patient wore, but able to detect early detection. That's what all this wearable technology is about, early detection. The earlier you can detect things, the more that can be done, the less bad it gets, like in the future. Kind of like me, I didn't even know I had AFib or anything before I went to the doctor's office. So conclusions, Need secure communications, which I talked about, data transmission, maybe a medical Wi-Fi is what I said. Amy, I know has a committee working on Amy and probably IEEE, I'm guessing at a higher level internationally, for all this wearable technology. Earlier detection could create better outcomes, healthier patient population, more and better healthcare at home, where like that virtual visit actually means something instead of just like, how do you feel? And you look fine, everything's good, okay, kid, family good, pets are okay, all right, see you later. Like, oh, we looked at your heart rate variability, we looked at your blood pressure, we looked at your pulse ox readings when you're sleeping at night, and we want you to come in for a sleep study, like something like that when you have a virtual visit instead of just random things. Hospitals will have higher acuity patients, like I talked about. Doctors or AI doctors will be more in touch with patients with more data crunching. So all this wearable technology creates more data. More data does great with AI, right? They kind of work hand in hand almost, AI and more data. And the AI can sort through all that data and come up with better answers for all of us. BMETs will be involved with technology and advancements. I think that the more sensors there are and the more pieces there are, maybe we'll even have more BMETs that are doing more at home health than what we do today. I think that's and then of course there'll always be hospitals because there's always going to be people that get in car wrecks or get, like maybe not as many car wrecks if we have AI driving our cars too, I don't know. Like the autopilot cars like there are today, but there'll still be things that happen. And there will still be a use for hospitals, but I think our shift in the future will change. And as we see in medical technology or medicine, it seems like nothing really happens fast. Because like I look at the newest computer on the market, I go, wow, this computer has so much better. I look at our central monitor for our monitoring system, like this computer is like from 10 years ago. Why do we have because it has to go through that whole process of approval from the FDA. So I think the technology might not move quite as fast. I mean, by the time I'll probably be retired by the time it gets to more outpatient stuff and more like hospitals just being higher acuity. But I think that biomed people will be involved because, if there's a way to mess things up, the users will always figure out a way to do it. And we're always the ones that fix it and figure out, we can kind of know the physiological part and the monitoring part and the patient part and be able to put all that together and be able to do our jobs. These are some references. Hexoskin, this is all stuff that where I got the information for these slides. That bottom one is that ultrasonic breast cancer bra that I was talking about. So, and then this is the code for scanning and letting them know how I did. Thank you everyone for joining me.